The June 20th, 2011 meeting of the Radnor Township Board of Health will come to order. Please rise and join me in pledging allegiance to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you for that. Has everyone had an opportunity to review the minutes of our last meeting? If so,
I do have one change
okay.
that I was looking for. It's under public comments. Under the second point, Brian McGowan, the last sentence would be in compliance with proposed revisions, since Mr. McGowan had taken responsibility for care, control, and feeding of the once feral cats. But I think we want to make comment that he would comply if they were licensed as well, because that's an important part that everybody should understand of 115.
Thank you for that. Ms. Mosier-Mills, you'll make that correction on your...
I wasn't actually here last month, so I didn't do the minutes.
I'm sorry.
I did those minutes.
Okay,
So
all right.
I can make that change. And because you
Thank
made
you.
changes and you sent them back to me, so I have them.
Thank you. With that amendment, are there any other corrections, additions? Do I hear a motion to approve the minutes? So moved by Dr. Humphrey. Any second?
Second?
Seconded by Dr. Donato. Thank you. All in favor?
Aye.
Any contraries? None. The minutes are approved as amended. At this point, due to his busy schedule, I'd like to move up an item under new business, and that is to introduce Dr. George Avedian, who is the Delaware County Health Advisor, and has been relatively recently appointed to that post. And Dr. Avedian is a graduate of Villanova, where he received his Bachelor of Science in 1976. He's a graduate of the Philadelphia College of Osteopathic Medicine in 1980, served his residency at Metropolitan Hospital Springfield Division. Dr. Avedian has been in private practice in Upper Darby, actually two separate stints, one 1983 through 1995, and then went back to that in 1999, where he is currently practicing medicine. Dr. Avedian is board certified as issued by the American Osteopathic Board of Family Physicians. Dr. Avedian, if you would come to the podium, I know you have a presentation for us this evening. Thank you.
Thank you, Mr. Hazen. First of all, I would like to thank you for inviting me this evening, and I want to thank Herb for his very supportive comments at the April 25th County Council meeting. This evening, I'm going to provide you with an abbreviated version of the new public health strategies that we're implementing in Delaware County. This is just one more part of a very proactive process. The fact that we're all here together in this chamber is proof positive of the mutual concern and established partnerships that the county has with its municipal and public health partners in the county. And before I get started, there was a little gap in my practice in Upper Darby, and the reason for that was for 4 years I had sold my practice to the Mercy Health System, and I was an employee of them, but the practice stayed where it was. So I've been practicing since 1983 in the 69th Street area of Upper Darby. Myself, I've been a resident of Radnor Township for 20 years. I've lived in Delaware County since 1966. I married 3 lovely children. One is in the veterinary field, a senior at Penn Vet, and 2 of them were trying to figure out where they're headed. This evening I'm going to go over an overall plan, a roadmap that's going to guide you through the implementation plan for strengthening public health services for our population in Delaware County. I believe that the Hopkins study reinforced that we have an effective system in place that is responsive to local needs. Hopkins identified areas that needed attention, and the county has therefore formulated an implementation plan to address these concerns. Our Department of Intercommunity Health and the Office of Emergency Services play a key role in collaboration with the State Department of Health and its regional center in Chester, as well as our major hospitals, of which we have 6 in the county. We have 3 health systems, as well as our municipal health partners and many other providers and agencies. Public health needs are constantly changing. The needs of our residents are always changing, and public health and safety threats we face are changing. 2 years ago, we dealt with the H1N1 pandemic, and we learned many lessons from that. We responded with countywide vaccination clinics, and the lessons learned at that time will be carried forward to be better prepared in the future. Now we're in the West Nile virus season. We've launched our surveillance and control program. County Council is very concerned of many other issues since I've come on board. We've dealt with prescription drug threats to younger people, and we brought all of our resources together to deal with this threat. We've informed our county residents of the new vaccination recommendations from the CDC, as well as the new USDA graphic on healthy eating, the plate that has replaced the pyramid. Most recently, I issued a press release about a week ago dealing with the hot weather and best ways to deal with it. What we've done is great, but we know we can do better. That's why I'm here. And I look forward to a constructive dialogue with Radnor Township, your Board of Health. I'm very receptive to your concerns and eager to assist in any way possible. We also know that there are populations in the county that are underserved due to language barriers, due to socioeconomic reasons, other situations, and we all need to work in unison to try to assist these people. In 2009, County Council engaged the services of the Bloomberg School of Public Health at Johns Hopkins. And my PowerPoint presentation will explain the process, and I want to emphasize County Council expended a lot of time, energy, and effort and consulted with top experts in the field, met with numerous concerned groups. They pored over volumes and volumes of statistics and health data, and they developed a plan that I'm going to be sharing with you in a minute. While Hopkins cited many strengths, they did make 4 key recommendations to enhance our system, and this is what we are currently addressing. I believe that the goal of everyone in this room is the same, to ensure the best public health and safety, not only for the residents of Radnor Township, but also to all of our neighbors in Delaware County. Some people might feel that it's best to focus on structures, names, bureaucracy that exist to address public health. My focus is going to be on the mission, the outcomes, and the actual needs of our residents. And I'm looking to address the public health issues in the most effective and responsible way. So I'm pleased to share with you this plan this evening, and I look forward to your collaboration in this process. And again, this is an abbreviated version of what was presented on the evening of April the 25th. So basically, we have the Hopkins Bloomberg School of Public Health was formally received by Council in March of 2010. The report presents an overview of public health in the county identifying issues, and making comparisons with other units of government. The report makes 4 recommendations, and they're focused on coordination, communication, collaboration, and public awareness. Recommendation number 1 was leadership, to designate and develop public awareness and recognition of a Delaware County public health leader. The qualities that they were looking for were a credible community presence, a focus on families and their public health needs, communication skills, engagement in dialogue and outreach, and a knowledge of the underserved populations. Recommendation number 2 was collaboration, communication, and coordination. And I'll just add that I think that this is the real thrust, the real meat and potatoes of the entire Hopkins study. This is where we need to be. We need to build on existing public health efforts through increased collaboration, communication, and coordination. We need to act on information, not preconceptions. We need to engage participants into the system, use systemic resources and address gaps. We need to build on community presence and capacity. We need to assess activity versus the perception of activity. We want to work with and improve existing communications, and the systems should provide applicable information. The third recommendation from Hopkins was research to strengthen the infrastructure and to obtain additional resources. We need to conduct further research on how best to enhance the county's public health system, with particular regard to strengthening infrastructure and obtaining additional resources. We need to identify the current resources and their limitations. We need to maintain fiscal responsibility and accountability. We need to build on success in obtaining outside funding. Question conventional wisdom. I guess the buzzword is think outside the box. And to consider statutory and regulatory change. Recommendation number 4 was oversight and evaluation. We need to establish a county public health task force or a similar entity with the responsibility and authority to oversee and evaluate the implementation of the recommendations. And basically, oversight and evaluation should be objective, transparent, and professional. So County Council hired the people at the Bloomberg School of Public Health, and they brought in a consultant to work with them once the study was presented, and they then put together an implementation plan based on the Hopkins study. So actions on the first half of 2011, appointment of the senior medical advisor. I know there was numerous interviews. Originally, I was interviewed on the phone, through internet. I had 2 interviews with the county's executive director and the consultant, and then with county council itself. And I was appointed to this position in mid-April. Other actions were designation of the senior medical advisor's roles and functions, and to integrate the senior medical advisor into the public health and emergency preparedness and response systems. I guess I had a little bit of a head start there. For the past couple of years, I've been a member of the Sheriff's Department in the Sheriff's Reserve Unit, and I had worked with Sheriff Joe McGinn in some emergency preparedness issues. So, going forward, continuing improvement of the information available. We have to look at county systems, the Pennsylvania Department of Health, Center for Disease Control, the healthcare providers. We have our websites and internal systems. We're working with the Delaware County Medical Society, the school districts, the intermediate unit. We have training and seminars planned. We have worked on enhancing the county public health webpage with links. Down the line, we're going to enter into the world of the social media with Facebook and Twitter and all the other high-tech toys that are available, in addition to the traditional newsletters, emails, and television. We're looking to upgrade integration with all agencies. We need to review public health laws and regulations. We need to refine the role of the Health Advisory Board. The Health Advisory Board needs to receive broader input. We want transparency, so there's going to be public meetings. We need increased information flow, and we need them to monitor the status of the implementation of the Hopkins recommendations. Both myself and Dr. Maureen Hennessy-Herman, who is head of Intercommunity Health, have sat down and met with the Health Advisory Board, and our next meeting, which will be in the fall, will be open to the public. We also need to establish the Oversight and Evaluation Task Force, and that has been done, and that is being headed by our Delaware County Coroner, Dr. Rick Hellman. We had our first meeting about 2 weeks ago, and Oversight and Evaluation is really going to be our teacher. They'll be giving us our report cards at the end of this project. We need to document the entire oversight and evaluation process. Next steps, we have a Public Health Information Working Group. Public Health Information Working Group is the real roll up your sleeves, let's get down to work entity. There'll be representatives from various groups within the county, and we're going to tap into their expertise and utilize them to help us put this whole project together. Obviously, I'm not an IT expert, but there are IT experts in the county. They're going to be part of this. So we're looking to bring in talent existing in the county and put them into this working group to keep things moving in a positive direction. We need to define public health information goals. We need to identify and address constraints on data collection, interchange, and use, and make sure that information is easily transmitted and shared amongst all the entities. And in that process, we're going to assess the county public health information systems and their capacities. And we need to also affiliate with state and federal health information programs. I have sat down with my counterpart in Montgomery County and with Councilman Severa. We are going to be entering into talks with representatives of the state and look forward to a constructive dialogue. We need to assess the Pennsylvania national public health structures. We want to confer with public health agencies and stakeholders, define priorities for access to available public health services, and to promote delivery to the underserved populations. That's kind of my little area. I do work in a community that is underserved. I have a very diverse patient population, very large ethnic population. Sometimes my biggest challenges are in communication. The idiosyncrasies of each of these groups are different, and you have to sometimes identify leaders in that community to help get the message across. And we do have a very large underserved population that needs to be helped. As I mentioned earlier, we're going to have public county health advisory board meetings. We need to identify metrics to assess our services and their outcomes. So, it's not good just to implement these programs, but we need a way to assess, are they working? And then I need to brief the county council, and I'm looking forward to probably do that in the fourth quarter of this year. That is the abbreviated version of the presentation that was given on the 25th. As I said, I look forward to working with residents of Radnor Township. I met with Larry a few weeks back, and I was very happy that he was able to reach out to me when he felt the need. I am available 24/7, 365 days a year, unfortunately. I do carry, from my own office, I'm on call every day of the year, and I don't have coverage group. That's just the type of person I am. That's the way I like to do things. So, again, I thank Herb for coming out on the 25th, and your words at that meeting were very supportive and very encouraging. We had a nice little meeting at my house subsequent to that, and I'm very receptive to listen to your concerns and needs, and looking forward to working with you.
Well, let me echo that. And as I said, on April 25th, we welcome the action of Delaware County Council in moving ahead with the Johns Hopkins study recommendations. And there's no question but that I believe you can count on not only my full support as you move forward in any way that you can possibly call on me, but I also think that I speak for my colleagues on this board and to that same extent. Are you able to stay for, I mean, we won't pepper you with a lot of questions, but if there are some questions that relate to your presentation, if we can keep you for another 5 minutes or so.
I'd be very happy to answer your questions, and if you want to have a separate sit-down session where we could go into things in more detail,
I'm
I could
sure
set time for you.
we will.
Sure.
Yeah. Let me open the floor then to any of my colleagues who care to raise any questions. Anybody? Okay, well, as I said, I think we will be wanting to follow up, and you know, I promise you, when you say 24/7, it won't be at 3 a.m. But there are issues that I'll just take one example. We recently had a couple of cases of chicken pox involving students in our school district here. I didn't hear of any further cases, so I'm going to assume that there weren't any, but that is on the side. How, in this new paradigm, does the school district and this board, when we become aware of those kinds of issues, communicate with you or with anyone else at the county level to make sure that there's appropriate follow-up? Because there are some questions that we don't know the answers to. Were those kids immunized? If not, why not? And those kinds of questions. And those are the things that people need to follow up on to prevent further outbreaks or an increase in any future outbreaks.
We're looking to partner with every entity involved in healthcare, whether it be the school nurses, the hospitals, or the healthcare industry itself. You know, vaccinations, immunizations are extremely important. I guess it was about 3 weeks ago at the council meeting, I got up and made a small presentation on the new CDC guidelines. Following that, we issued a press release that went out to the communities, encouraging families to take their children before September, you know, during the quieter months, to make sure that they're all updated on their immunizations. There will always be issues that will present, whether it's varicella or pertussis, and we will deal with them. And we'll deal with them aggressively and as expeditiously as possible. As I said, you know, we're looking to work together. The Department of Intercommunity Health is the one that usually does the communicating with the school nurses, and through Dr. Maureen Hennessy Herman, the information will get to me, and if appropriate and if necessary, I will become involved.
Thank you. Just one more matter, and I don't know if Dr. Donato or Dr. Humphrey can chime in on this. We were chatting before the meeting started about the recent developments with regard to the county council asking the local SPCA to defer their action to cease taking in animals for 6 months, and they are not prepared to do that, is my understanding. What is the next step in the view? Because we, except for Dr. Donato's practice, we may not have all the facilities that we need to have to deal with that here locally, and I'm sure there are other municipalities and townships in our county that are in the same straitened circumstances.
I can tell you that I've had many conversations with Councilman Mario Silvera. Mario is a passionate dog person. Ever since I've known him, and I've known him for close to 30 years, he's always had Shelties or Border Collies, and now I think he's changed his flavor recently, but he has been working tirelessly on this project. Unfortunately, he needs a little bit of extension of time to get the proposed facility constructed. He has reached out to all the players. He has gotten the trades, the construction people, to donate and volunteer time to build a facility. He has input from experts to make this facility a state-of-the-art model that other counties and other regions will want to copy. Unfortunately, he needs an extension of time. There was a group that presented 2 weeks ago at the council meeting expressing concern about this issue, and Councilman Silvera got up and spoke for about 15 minutes at the meeting. I know that he's working very hard on the project. We will get an update tomorrow at the council meeting. I'll find out exactly what's happening. I had offered my services to him. There's little that I can do, but unfortunately, the SPCA does not want to grant an extension, and it appears that the municipalities are going to be responsible for care of the animals until we can get this facility up and running. As far as when the facility will be available, it'll probably be sometime in the fall. Other than that, there's really not more that I could add tonight.
Well, I thank you for that. If there are no further questions, again, I know at least you and I will be in touch. This board does not meet normally during the summer months, so our next meeting is in September, the third Monday, and perhaps by then you and I will have had an opportunity to meet a couple of times over the summer if you're available, and I can endeavor to brief the board on what's happening. Thanks.
I will
Thanks
provide
very
you
much.
each with my business card, and feel free to reach out to me at any time.
Thank you.
Just,
I have your card, thanks. Yes, I do. Okay, at this point, I'll ask Mr. Taltone to provide us with the announcements and the health officer's report.
Good afternoon, Mr. Chairman, board members. I have a report for May of 2011. of the inspections that I've generated over the last month. During the month of May, we did 16 food safety inspections. It's a huge month for pools to open up for the season, where we did 28 pool opening inspections, and we had 18 quality of life concerns. Of those quality of life concerns, they range from, raccoons biting pet dogs to high grass and weeds, and we even had a dog bite a police officer during that time. In June the 11th, we had the 2011 annual Jazz and Food Festival in North Wayne Avenue. It was very, very successful. I hope everyone had an opportunity to stop by. In upcoming events, we have the 2011 Fall Festival, which is going to be September the 18th, the day before we come back to meet again, which will be on my birthday, actually, September the 19th. You'll find in your packet the Volunteer Medical Services Corps for Lower Marion and Narberth. They respond to Radnor Township for emergency services. Also in your packet, you'll see where we have the Health and Safety Fair, which is going to be held here June the 29th, 2011, from 8 o'clock to 1 o'clock. All residents are welcome to attend. It's going to be a lot of good health and safety tips, a lot of stuff for the senior citizens in the township. Someone will be here to talk to you, and I need a little help with that myself as far as helping lose the weight, to manage diabetes, blood pressure, those type of things. So that'll be on June the 29th, 2011 here at the Township in this very room and in the hallway outside. With the Pennsylvania Health Alert and Alerts Advisory and Updates, May the 26th, 2011, we had one. It was a Health Advisory 0206, possible cases of necrotizing. Oh God, I'm messing that all up. Anyway, we had a health alert there. And we had one June the 7th. It was a health alert regarding outbreak of E. coli. It was a warning regarding travelers returning from Germany. Mr. Chairman, so ends my report.
Thank you for that. Are there any questions of Mr. Taltone? I have one, and it references the Health and Safety Fair to be held here on June 29th, as you've mentioned, between 8 and 1. It's possible, and Dr. Frank Burke is once again here, as he was at our last meeting. Dr. Burke, if you'll recall, is the medical director of WorkNet Occupational Employee Student Health Medicine at Hahnemann University Hospital. If possible, in a conversation I had with him before this meeting started, Dr. Burke is going to look into the possibility of getting us some materials for that meeting. Would you, Mr. Taltone, be the right person to whom those materials should be delivered?
I am, and I've already given him my card.
Good. Thank you.
I had one other comment. I went out with Larry on a few calls that he had, and I just want to say that it was a great experience. Saw there was an abandoned property that had to be checked out, a pool and a dining facility, and I learned quite a bit, and Larry has quite a bit of knowledge over there. And I was always wondering what these, quick little bullet points on his report were. There's really a lot that goes into each point, and we easily spent, I think, 3 hours at the one facility. So a lot of work involved, and I just wanted to, make sure everybody knew that. And also, if you do get the opportunity, have a day off and want to spend it with Larry, it's a really good experience.
Thank you,
Thank
Dr.
you.
Nutter.
I've also had that opportunity several months ago to do that very same thing, and I would totally agree with you. It's an eye-opening experience, and Mr. Taltone is certainly an expert, and it's a pleasure to I just tag along with him and watch him at work, so if anybody does have that opportunity, I know he would welcome that sort of participation.
I do welcome it anytime.
Moving right along, we'll take up old business. Dr. Leader, the first item is teen health issues. I know you were looking at the video earlier.
Yeah, Allison and I had a chance to go over with Mr. Doling and see how the editing process is going, and Allison can chime in if she wants to, but I think it's coming along very nicely. And Mr. Doling has spent a lot of time editing that, the material that we put together, and I think it's going to turn out very well. I think we're in the home stretches. It's just a matter of sequencing now and putting things in the right order and making sure the names are under people and that sort of thing. But it's almost finished, and it will be on the website, I would imagine, shortly, and available for the students in the fall.
Thank you. I'm glad you mentioned that. I think the fall would be a good time to launch that because people are away for the summer, and that would be wonderful. The other two items under old business, Radnor Reach, Amy Wishner is not here, and Genevieve Burns for EAC is not here either. So we'll defer those updates for our first meeting in September. And we've, under new business, unless there is any other old business that other members have. Under new business, we've had the presentation by Dr. Avedian, and if there are no other items other than the business to do with Ms. Mosier Mills, what I'd like to do now is to ask the board members to join me below our podium here so that we can present her with this wonderful certificate. Let me read the certificate though first, since I'm at a microphone here. It says Radnor Township Board of Health, Certificate of Appreciation, Allison Mosier Mills, in recognition of your dedicated service to the public health, safety, and welfare of the Radnor Township community and volunteering as the first student intern to the Radnor Board of Health. Please know that your work is appreciated, and we thank you for your service. And it's signed by John Fisher, the President of the Board of Commissioners, by myself, and by our Township Manager, Robert Zinkowski. So, we also have in appreciation, the Board of Health has got a card for you, which we've signed, and there's a gift card to one of our giant bookstores there. You will, I know, appreciate it. So,
Thank you
again,
so much.
thanks for your wonderful help and your contribution. I mean that sincerely. At this point, let me ask Ms. Mosier Mills' family, she has her mother and father and sister here, to come forward and they can do a photo, a family photo.
Do it again, just in case I messed up.
Okay, now, I'm assuming we can send these photos as a digital camera? And,
He
okay,
just
Mr.
presses the
Dolan
button.
will
Just press the button. I have to see here.
we can send these photos, because I know Mark Skellinger, the principal, is interested in having a copy of the photo for the high school. And Lisa Williamson, who's Director of Communications, has indicated they'd like to post it on the district's website. So the way that I can think of to do that is it.
Thank you from the Mosher Millicents for letting her do that. She really had a, not just fun, but she had an interesting experience doing it. The meetings were fascinating. She felt like she had the inside.
That's right. Who knew it was said that?
Yeah. Right? That's how we know what all the restaurants are opening. It really is. Thank you for trusting her to do it.
Oh. Allison has set the bar so high for any future interns. We may never have another one. It really is good.
Mr. Hayden, you can do that.
Oh, to go to
It is a digital camera. May I have the certificate back for a minute?
The fan base heard that we were coming to today. And they wanted to send their greetings to you. Oh my gosh, how adorable.
We have about 100 photos of us.
Not Sarah, right?
Cats sleeping here, cats sleeping
In
there.
fact, the girls video chat from the second floor just to show me a picture. Sleeping on the bed.
We don't want to move them.
That's right. We never want to-
There is a word that needs to be corrected. We hope you'll have this. That was my typo. We're going to get a new certificate made up. Okay.
Also, I spelled
With one L. Okay. Allison is with one L. Okay.
But Mosher Mills, you got right.
Yeah.
It's usually
Moiser. Years.
Thank you.
Good luck to you.
Yeah, that's what Allison. Thank you.
Congratulations.
Wonderful. Having you so
Congratulations.
much. When the final video is done, I'll send you an email.
Okay.
You know, to keep an eye out for it.
Okay.
On the website. It's good.
That's great.
Right on your friends everywhere. Thank you so much. Well, a lot of them are in it, so these are going to see what they look like. Yeah.
And you know, Allison, I know the biology teachers and the guidance counselors, I never heard back from them. It could have just been that it was really close to the end of the year that they were
Yeah.
super busy. But when do you open back? Like,
I'll wrap it with you. Yeah.
do you think it would help if you email us?
If there is no further new business, we'll go to the public comment section of the meeting. I don't know that there is any this evening, and seeing none, we'll move to adjourn with the note that our next scheduled Board of Health meeting will be September 19th, 2011, at 5:00 p.m. in this room. Thank you all for coming. The meeting is adjourned.